许多儿童摇着羽绒被
We'd like to tell you some stories. Stories about water.
Children died from drinking the polluted water.
I know this water is dirty, but what can we do? We are poor people. Clean water is far away and we have to pay for it. That's why we come here. We have to wash our clothes and bathe in the river.
Over 3 million people live in the slums in Dhaka, the capital city of Bangladesh. Most of the poor here have no access to clean water or sanitation. This is the fastest growing city in Asia. Dhaka's water supply and sewerage services have been overwhelmed by this rapid rise in population. Close to 10 million people live in the city, and the number is expected to reach 16 million by the year 2010. In a burgeoning megacity like Dhaka, in one of Asia's poorest countries, providing clean water and sanitation for all will be a daunting task requiring imaginative solutions. In some of Dhaka's poorest slums, a successful grassroots solution is catching on. With assistance from local non-government organisation Dustha Shastya Kendra, or DSK, community water points and latrines are being introduced, managed by the slum communities themselves.
Bangladesh is known as a poor country, and around 25 to 30 million people live in abject poverty, which is described as people who are earning less than $1 a day and eating less than 1800 calories a day. People in rural areas are coming to Dhaka city in search of work, employment, food and shelter.
Dhaka has been a big magnet. It's the biggest city, very centrally located, and the policy over the last 20 years have been to centralize many of the things like industrial employment. 2 million people have been in new employments in the last 15 years.
We used to stay with our grandmother who lived in Kumilla, but the house there was lost in a flood, so we all left and moved to Dhaka.
I came to Dhaka to earn some money because village life is hard and there was a lack of food and water. Here, I do the housework and my husband operates a rickshaw. This is how our family survives.
Everybody needs water. So there is a whole big trade going on. For example, you go to a fish market and they need a lot of water, keeping their fish fresh or cleaning the shops. And there is a continuous flow of water brought by women in this profession. So there has been an arrangement of informal network providing water to whoever needs it.
Asia Begum lives in a typical crowded slum near the embankment of the Turat River estuary. She can only afford to buy a little drinking water each day for her family from private vendors. The polluted river is her source of water for washing and cooking.
I need to get water 10-12 times a day. There is no clean water to cook or wash with. It's very hard here with no well and no water supply. We have to pay 1 taka for 1 jar of clean water.
There is no any pipe water system here for poor people. They go to the river. The water is dirty, but they go there for water for their daily activities. For drinking purpose, they collect water from a private vendor. So it is costly. I think 10 times, 20 times more than the pipe water system. 100% of the toilets are hanging latrines. It is very tragic situation. People place a piece of bamboo. They are using that bamboo as a toilet. And under the toilet there is water. They also use this water for other purposes, like washing clothes, etc. Sanitation is very bad here.
I know it's going to affect our health badly, but we are poor and we have no other choice. It's hard for us to buy drinking water and we can't afford to use it to clean household things.
When it comes to providing water service to poor communities, the publicly owned city water utility is caught in a bind. In an effort to stem the tide of migrants streaming to Dhaka's slums, government regulations prevent the Dhaka Water and Sewage Authority, known as DWASA, from providing service to illegal squatters.
There are two distinctions. One is private slums, the slums which has been created on private land by the landowner. And other is slums which are on government land, illegal. There is no legal water available in those slums. They were not recognized as legal clients to DWASA because they had no mandate on land.
By law, we cannot provide water connections to the slum areas because the law says anybody that wants a water connection should be the holder of the title of the land, which the slum dwellers do not have.
The law has been a major obstacle to connecting the poor to the city water service. That is, until DSK pioneered their innovative scheme to break through the legal barrier. The NGO have been providing primary health care in slum communities since 1988 and had identified the lack of access to clean water as a serious health concern. This method of community water supply, the DSK model, as it's come to be known, is catching on in the slums of Dhaka as an effective local solution to a mega city problem.
We tried to communicate and make a bridge between Dhaka Wasa and the community who are down there to play a role of intermediary between two of them. Our submission to Dhaka Water and Sewerage Authority was that, okay, these people are using your water. They are buying this water from other intermediaries who are charging them much higher rates than you are charging to your clients. So what if you give them access to your service and they carry on paying you regularly? So they agreed as an exception. I still remember the then Dhaka Wasa managing director. He actually demanded that if this squatter dwellers fails to pay, we will pay from our own account.
DSK made this important breakthrough in 1992. It was the beginning of a partnership with the water utility to connect slum communities.
Access to water and sanitation is a fundamental human right. With that view, we joined with them and extended our support to the slum dwellers so that they can have access to clean water at the first place, and then later on we will be providing proper sanitation facilities to them as well.
The people who have legal connections get water at a reasonably affordable rate. The poorest who do not have legal access have to pay very much more for their water source. So I think the credit should go to the NGOs who were serving the people in the slums for making this pioneering initial move that they have the right to water.
This is Bomiabad Mirpur, where DSK is working with the community to provide water and sanitation. It's a small slum of 170 families, their tin shacks clinging to a narrow embankment between two small lakes on the outskirts of the city. Before, residents used hanging toilets over the lake and washed in its polluted waters. Since they were illegal squatters on government land, Dhaka Water could not connect them to the water supply.
We used to fetch our water from a distance. Then Dustha Shastha Kendra installed a pump. Then they came back and asked us how many households there were and how many hand pumps we needed. We showed them a place to put the water point. First of all, they put in 2 pumps and later another 2.
Zakil and his wife Rahima have been DSK partners from the beginning, setting up the water points and toilets and later actively involved in the water point committee. They and their neighbours have to make sure they earn enough money to pay DSK back for the cost of construction. Zakil has been living here since childhood.
We were struggling to survive because we could not get clean water. There were some pumps far away, which were hard to get to. Some were polluted. Many children died from drinking polluted water. People often could not bury their children properly because they had no money to buy the cloth they needed to wrap the bodies in.
Zakil and Rahima lived through the worst of times, but then the situation began to change.
It used to be very unhealthy here, but we have learned a lot of good things living in this improved environment. We used to use the water from the river marshes, but it caused many diseases in our children. So it's a blessing that we are now safely past those days.
A hand pump is used to draw water piped from the utility to a holding tank under the water point. Access to a clean water supply and installation of toilets has brought about a big improvement in the health of the people of Balmiabad Mirpur. It also led to other important changes in the community. Residents learn to cooperate and organise to operate and maintain the water points themselves and to collect the money to meet the payments back to DSK.
We have 9 members in our committee, all with different responsibilities according to their skills and ability. I have been selected as chairperson. Every month, we have to pay 3,000 Dhaka for the water bill and for the water point loan. Sometimes we put some pressure on members who can't pay. If some members can't pay, the committee members help them to pay. This is how we have structured our committee. We have very good relations in the group. We listen to each other and respect each other's opinion, and the community then listens to us. We also collect money to pay for cleaning the water point and the pump on a weekly basis.
The slum dwellers never fail to pay Diwasa. If you give this group of people access to certain basic services, they will pay you back, and there is no doubt on that. Because they immediately understand that, yes, this is my scope and this is my opportunity.
This most elemental change, access to clean water, has triggered a ripple effect of other changes throughout the community and raised residents' awareness about the health risks that surround them. Public latrines were installed with collection tanks to prevent further pollution of the lake. These tanks are emptied regularly. Residents keep their homes clean and tidy, and the pathways through the community are swept and kept free of refuse, in stark contrast to the conditions in other squatter areas. It's all part of a sanitation and hygiene campaign spearheaded by DSK health workers to improve health and living conditions in the community.
Since they are not using the pond water anymore, they are not having any more problem with skin disease and diarrhea. I am giving training on different things such as covering food, washing hands with soap and many other things to help them be more aware of hygiene. I check on them every day and they have improved a lot. Also, people are educating their neighbors about hygiene. I have trained 20 members and they are training another 20. Every month, the committee cleans the water point twice. There are 50 members in the committee and every day one of them cleans the washing place.
50 জন সদস্য প্রতিদিন একজন সদস্য করে গোসলখানাটা পরিষ্কার করে।
almost 95% of members in those microcredit network is women. There is a strength in women. They are generally engaged with the services of water. They will cook, they will wash, they will clean children. So all these things relates to water. In our country, we have our own socio-cultural religious biases. In that setting, women is a little bit weak in terms of bargain power. Because of this type of activity, she becomes a social leader. And many of our water points projects, sometimes we face slum mastans or hoodlums. They are coming and trying to fetch water without paying any bills. Then women came forward and tried to block them. And those mastans wanted to beat those women caretakers. And then there was a social meeting in that community, and they were brought to beg pardon from these women. So through this type of community building exercises, women empowerment also takes place. It does not come automatically, but it gradually provides women strength. Because of that, they can say, okay, you cannot take water without paying bills.
DSK would like to see community-run water points established throughout the slums of Dhaka, but it has not been easy to expand due to frequent evictions of slum settlements. A squatter settlement here has been recently levelled by authorities to make way for a wider road.
This is Majar Road area. They have been living here for last 10-12 years. Recently, government has decided that this road will be extended. That's why most of the households lying at the side of this road has been evicted. So now they have shifted their households to other areas.
Since 1999, we are having unprecedented slum eviction in this city. So, pity is this, that many of our projects were demolished when community already paid it back fully, and after that, one fine morning, that was demolished. So you see, in that sense, we are loser. Number two, community becomes also loser because they had paid in full and now there is zero.
Despite the difficulties, the DSK model of providing clean water, sanitation and hygiene in the slums has been replicated across Dhaka. It has been taken up by other non-government organisations now working with Dhaka Water in the same way.
We have 120 water points serving different slum areas through about 5 NGOs. On the average, we are serving 500 people per point. So we are covering about 60,000 people in the slum areas. This is not very significant. But I said that we have started something good and we plan to extend on it. So within the next 5 years, we want to cover the entire slum area.
The DSK scheme will soon be scaled up and implemented in other cities and towns of Bangladesh, with international donor assistance. The drive to connect the poor is gathering momentum, but there's still a long way to go.
In about 15-20 years' time, this city will be the 4th largest city in the world in terms of population. It's about 20-25 million, but in a larger area. If Wasa has to provide water to this huge population over a huge territory, they have to expand their activities. This shift from groundwater to surface water from the Shitalakha river, Saidabad plant, is not enough. So they have a plan to go out to the big Ganges and get water from that source. Luckily, we have several rivers around, so that will be expensive but possible to get surface water.
What is the actual possible, realistic, pragmatic solution for this problem? Just not to say, oh, I don't want the slums here. Yes, nobody wants that. No slum dwellers want to live in slums, that is for sure. We have to arrive to a pragmatic solution. We cannot throw this group of people who are a majority in this country to Bay of Bengal. That is not possible.
Somehow this rapid influx of population has to be slowed down. So you need some nationwide, countrywide program for that, a policy directed towards that. That means you have to somehow discourage people from all coming to Dhaka. There is a policy of trying to provide security of tenure to the poor in the city as well as in the rural areas. We have to resolve tenure security, and sooner the better. The long-term, permanent, sustainable thing would be to go for pro-people, pro-poor policy, which in manifestation is insecurity of tenure.
When there is opportunity in cities to get more income, nobody will go back to these remote rural areas and to again drop into their poverty life. They want to have a good life.
I have lots of dreams for my children. My husband is working in the restaurant, but he's getting less work. We're poor and going through hard times. My main concern is how to raise my children and how to pay for their education so they can have enough food and don't have to worry. These are my dreams. This is what I really hope for.
If the goal of providing safe water and sanitation for all of Dhaka's residents is to be attained, the problems of space and security of land tenure for the city's many poor and landless citizens will have to be addressed. With the most at stake, poor communities must be at the centre of any solutions found. For Dr. Singer, this is not a liability, but an opportunity.
I always feel that this country and its people has got immense potential, because when I go to slums, you will see these people as in dire condition, but they are willing to do something. You should not leave community at the corner of your room, but bring them at the focus of your main activities. Then they will give you many answers.